So we're going to get started on joints now. And joints are articulations, meaning this is a connection between the bones and allows them to generally move. Sometimes they don't, but generally they move. These joints bind the skeletal system together. It makes it possible for the bones to grow. It permits part of the skeleton to change shape. We'll talk about during childbirth, that pubic symphysis. And it allows us to move in response to what the skeletal muscles are doing. All right, so when we take a look at joints, we can look at a structural classification or a functional classification. So if we look at structural, how is it structured? Is it fibrous? Is it cartilage? Does it have this complex structure called that is filled with synovial fluid, and we call it a synovial joint? And then we talk about a classification on whether it is movable, slightly movable, or we can do pretty much anything with it. So let's take a look at the fibrous joints. As you can imagine, it's held together with dense connective tissue that has a lot of collagen fibers. It's found in bones that are that have very close contact. There are 3 types of these joints: syndesmosis, sutures, and gymphosis. The syndesmosis, these bones are bound by a sheet of dense connective tissue, or what we call the interosseous membrane, or a bunch of dense connective tissue, basically a ligament. These are amphiarthrotic, which means they are flexible. You can twist them. This is between the tibia and the fibula, for example. So we have our tibia and our fibula, and you can see that membrane between it. And we have the ligament that's holding this together. The lateral malleolus, basically what you consider kind of like sticking out that ankle. The suture has a thin layer of connective tissue. This is a sutural ligament that connects the bones. This is immovable, so this is a synarthrotic joint. These don't move. We don't want them to move unless, if our brain swelling, that's a different story, but in general, they are not going to move. The gymphosis, this is a cone shaped in a socket. This is also immovable. This is the root of the tooth in the upper jaw or lower jaw, the maxilla and the mandible, and it's held in place by a periodontal ligament, and you can take a look at those. Okay, and your cartilaginous joints, these are connected by hyaline cartilage or fibrocartilage. There are 2 types of these. Again, you can see this chondro in there because it's cartilage. So synchondrosis or symphysis. The synchondrosis is a band of hyaline cartilage that unites the bones. Basically, some of these are temporary, such as an epiphyseal plate. Some of them are permanent, such as between the cartilage, between the manubrium and the first and the rib, the costal cartilage. And the other one is the symphysis, and this is a pad of fibrocartilage between the bones. This we're going to see mainly in the pubic symphysis, between the 2 pubic bones and the pelvis, or the joint between the adjacent vertebrae are intervertebral discs. Okay, so we can take a look at this. You can see that costal cartilage right there and that joint there, and you can see the pubic symphysis with that fibrocartilage, and again you can see those intervertebral discs. The synovial joints, those are what most joints are, and they have a very complex structure. They have an articular cartilage that covers the ends of the bones. They have a joint capsule that is two layers. It's an outer fibrous layer and an inner layer. So you have a outer fibrous layer, which is ligaments, and then you have that inner layer, which is the synovial membrane, and that secretes this synovial fluid that we'll talk about. So all these parts make up that synovial joint, and you can see you can have that, and then you have a meniscus and sometimes a bursa that we're going to talk about. All right, so I will mention that synovial fluid we'll talk about, but it should be clear in terms of, it's usually a light yellow color, and it's fairly clear and fluid, and when it gets gunky is when we start to have problems. It gets more solid. All right, so the 6 types classified by shape and movement. So we'll take a look at those. Ball and socket joint. Most of us are pretty familiar with a ball and socket joint. That's our hip and our shoulder. That you have a round head that fits into a cavity, and we're going to go through the names of these cavities when we get to the hip and the shoulder. This gives us a very wide range of motion, so it is multi-axle, and we can do this in many different axes, and we can rotate this joint. Condylar joint is also called, basically it's an ellipsoid joint. You have a condyle that fits into an elliptical cavity, and you can get this back and forth and side to side, so it is biaxial. There's no rotation. This is the joint, we'll take a look, between the metacarpals and the phalanges. So you can see this ball and socket. There's the head of the femur fitting into the socket, which is the acetabulum. And you've got a lot of range of motion here. You can see that rotation. The condylar joint you can see right here between the phalange and the metacarpal, and you can see that 2 motions. All right, a plane joint is also called a gliding joint. It's almost flat. It's a back and forth and twisting motion. It's our wrists and our ankle joints. It's the combination of a lot of those bones moving that allow us to do this movement in the joints. The hinge joint is just exactly like a door. I mean, it is a hinge. It is in one plane, and elbow is the joint between the phalanges that you can move in one way, or the elbow is pretty consistent. So you see that plane joint where you can do that movement back and forth. And the hinge joint with the hinge where you can open and close your fingers or open and close your arm. All right, the pivot joint, basically you have a cylindrical surface that rotates within the ring of some other bone. You are literally pivoting. You are only getting rotation. The example of this, and I'll show you this when we get in the, again, we got in the lab, sorry about that. And we showed you the atlas and the axis, and that den sticks up and the atlas is able to rotate around it. A saddle joint has both concave and convex surfaces, so that you can move in 2 planes, and these are the carpals and the metacarpals of the thumb right in here. So there's your pivot joint, there's the dens of the axis, and the atlas is allowed to rotate around so that you can rotate your head. Whereas the saddle joint, you can see right there that concave convex space, and you can move that thumb in several different, in that 2 different actions. All right, so when we talk about the movements of the joints, we're going to get into the skeletal system, but it is the skeletal system that produces the movements of these joints. The origin is the fixed end of the skeletal muscle, and the more movable end of the muscle is the insertion. So if you think about your arm, basically, where it's pretty fixed, that's going to be the origin, and you're going to insert where you can actually move it a lot. So the movement of a joint occurs when the muscle contracts and its fibers pull the insertion towards the origin. Now, the kinds of movements that we can do we're going to go over these, and this is important because when we go over the muscles, and you're going to be required to know the names of the muscles, you're going to have to be able to state what is the movement. So it flexes the arm, it extends the arm. On the test, you can't say moves the arm, moves the leg. That's going to be marked wrong. You're going to have to say flexes the leg, the knee, flexes the knee. All right, extends, whatever. Pronates, supinates, does dorsiflexion, plantar flexion. So you need to know these terms. So we'll kind of go over these. Flexion is where you bend the parts at the joint. So when you bend your arm towards you, we'll look at pictures, that's you're flexing. When you're straightening that arm out, that's an extension. If you extend it beyond what it's supposed to be, like you take your head and you take it and tilt it all the way back, that's a hyper extension. Lateral flexion means you're bending side to side. Now we have abduction and adduction, and this is where you're basically moving away. Adduction, you're adding to. All right, so this is, you would be moving your arms or legs away from the midline and towards the midline. So if we take a look at picture, there's your leg, moving the leg out is abduction, towards the midline, adduction. Lateral flexion, this flexion, bending it, straightening it out, extension. All right, same thing with the arm. Dorsiflexion, plantar flexion. This has to do with the ankle, and this is ankle movement, where dorsiflexion, you're pointing your toes upward. Plantar flexion, you're pointing the toes down. Okay. Circumduction is where you're moving it in a circle. Rotation is when you move a part of the body around an axis, like your head. You can have medial rotation where you're moving it towards the midline, lateral rotation where you're moving it away from the midline, and then you have supination and pronation. This is primarily in the forearm, and the muscle actually is called a pronator. So when the forearm rotates to the palm, you're in an anatomical position, and the forearm is rotated so the palm faces downward or backwards. All right, you're pronating, and when you turn it back up, it's supination. All right, so you can see this dorsiflexion where you pull the toes towards your leg, and plantar flexion where you flex it down as if you were going to be a ballerina and dance on your toes. And then circumduction, we can do that with our arm. We can move that in a circle, and you can see the medial rotation towards the middle, the lateral rotation outwards, and again this supination and pronation. Another one is inversion and eversion. This is the turning of the foot so the bottom surface faces the midline, and then eversion so that it faces away from the midline. Protraction and retraction is moving the body part forward or backwards, kind of like your jaw. We'll take a look at that. And then elevation and depression, you're raising a body part or lowering a body part. So look at that inversion. You can see that you're moving it towards, tilting it in towards the midline, and eversion towards outward, and protraction with the jaw, and elevation where you're raising the shoulders, and depression where you're lowering the shoulders. So some of the examples of the synovial joints that we're going to look at is the shoulder, the elbow, the hip, and the knee. Those are the very, very classic. These are very freely movable joints. And if you look at the shoulder joint, that's a ball and socket joint. And it's the head of the humerus, which is the arm bone, that fits into a cavity called the glenoid cavity of the scapula. All right. That's a fairly loose joint. We'll talk about this. If you got the ball and socket joints, or the hip joint and the shoulder joint. The shoulder joint can actually be moved out of joint fairly easily. The hip joint, not so much. But it's easy to dislocate a shoulder because that glenoid cavity is just not as deep as the acetabulum of the hip. Okay, there are several bursas, pockets in there. Is a wide rate of motion. There's a lot of circumduction you can do, a lot of rotation. You can use that shoulder joint because that socket is not so deep. You get a lot more movement in there. All right, so you can see that clavicle coming in, and right there, and you can see that joint cavity, and you can see the scapula in the back. We'll take a look at this. In fact, we did. I have to keep reminding myself that we're doing this afterwards. All right, so the elbow joint has two articulations, either a hinge joint or a plane joint. We looked at these bones, and I showed you the trochlea of the humerus, and so this is the hinge joint is between that trochlea where it comes over that trochlea, and you can do that flexion and extension. The gliding part of that is between the capitulum of the humerus and the head of the radius, where you can actually pronate and bring it over. Okay, so you can take a look at that. Experiment with your own arm. The hip joint is a ball and socket joint. As we talked about, the head of femur fits into the acetabulum of the hip bone. This is a heavy joint capsule. There's a lot of reinforcing ligaments. You can't do as much movement with the hip joint as you can the shoulder joint, but again, it doesn't dislocate as much as the shoulder does. You get hit and the shoulder real hard, you can dislocate that very quickly, and you can take a look at that nice head of that femur coming in. All right, the knee joint, very, very, very complicated. It is the most complex synovial joint. There's three bones involved: the femur, the tibia, and the patella. All right. You have lots of ligaments, lots of tendons here, and it's cushioned by fat pads. There is a meniscus that separates the femur and the tibia. It is a modified hinge joint. It can be a plane joint. You can do flexion, extension, some rotation in this knee joint, but you can take a look at this. And you can see the joint cavity, you can see the patella there. It's a very complex joint here, and you can see the menisci in here, in the bursa. Very complex joint, very interesting to do, okay? All right, so that's our joints, and we are now on to the muscles.